Minister of Health, members of the Diplomatic Corps, Dean of the Cabinet, distinguished ladies and gentlemen. This I'd like to welcome you to the souvenir program marking the commissioning ceremony of the oxygen plant here at Starbase, Maserado County, Addis Ababa. May we all stand for invocation by Reverend Dr. Imari Imle, Religious Advisor to the President of the Republic of Liberia.
Let us bow our heads. Our most gracious Father, we thank you, we bless you for this day. We thank you for blessing our country with this oxygen plane. Lord, we take your glory as we go through this program. Let your name be praised. Thank you. In Jesus' name we pray.
Thank you. Have a seat. At this time, we will welcome Honorable Florence Burnett, Superintendent of Maserado County, who will now give us a welcome remarks and introduction of this project. The Superintendent.
All right, the Honorable Superintendent of the County of Maserado, Madam Florence Burnett, moves up front.
While still on the existing protocols, we now stand and call on the AFL March Band for the national anthem. May we all stand?
All right, we have the marching band strikes up. National anthem of Liberia.
Thank you.
Armed Forces of Liberia with the national anthem, and that will be followed by welcome remarks and introduction of the project by the Superintendent of Maserado County, Madam Florence Burnett. Let's go to the podium.
Weah, First Lady of the Republic of Liberia, the Dean and members of the Cabinet, government officials here present, the special representative and members of our development partners, our one UN family here present, members of the press, ladies and gentlemen. Today we want to give God, the Almighty God, the thanks and appreciation for this great project. We also want to extend our thanks and appreciation to the One UN family for the continued support that they gave to Liberia, with Maserado County being a beneficiary. Today, Your Excellency, our health system has suffered multiple shocks, including the Ebola virus and now the ongoing pandemic in Liberia and the world as a whole. Lessons learned from these public health events have highlighted the critical need to build a resilient health system with an effective service delivery component for better health services. To support the COVID-19 preparedness and response, our production, supply, and distribution in Liberia, the oxygen production and distribution in Liberia was conducted by the Ministry of Health. An assessment of the oxygen production, supply, and distribution was done by the Ministry of Health with support from partners. This assessment revealed that Liberia had only functional oxygen plants with the capacity to produce 30 to 40 cylinders of oxygen per day. The government and partners acknowledged the critical gap and developed a roadmap to improve the production, distribution, and utilization of medical oxygen in Liberia. The World Health Organization, with office in Monrovia, Liberia, with support from regional office from Africa and headquarters, with the funding from the German, Canadian, and the American government, embarked on the procurement and installation of 2 PSA oxygen plants in Liberia, the Starbase and Pommy County. This plant at Starbase has the capacity to produce 100 cylinders of medical oxygen per day, and it is the largest in the country. The Starbase plant is intended to serve an estimated population of 2 million inhabitants in Monserrado County and Magnipi County. In addition to the plant, WHO supported the renovation of the building to serve as a shade for the plant. A training center for health workers constructed a generator house and procured and installed a 150 kVA generator at the Starbase. Your Excellency, we cannot overemphasize the level of support that we get from the UN family and our international partners. We just want to say thank you so much. And on this note, Monserrado County, the largest in terms of population, and with greatest I know who will benefit from this project, we just want to say on behalf of the peace-loving people of this great county, we want to welcome everyone to this program. And we pray that this oxygen plant will serve and reduce our health crisis, because we know it will not only be used for COVID-19, but it will also be used for other health services. Thank you so much, and you are most welcome.
This time we'd like to recognize the presence of Ambassador Weah, Deputy Mission, representing the U.S. Ambassador here, and also His Royal Highness, the King of the Yoruba tribe. We say welcome. At this time, we will now welcome Dr. Clemens Lugada Peters, delegation represented to Liberia for overview of this occasion.
Dr. Clement Lugala Peter is now on the podium.
Your Excellency, Dr. George Weah, President of the Republic. Excellency, Madame Claire, First Lady of the Republic. Members of the Senate and the House of Representatives present here. The Dean of the Cabinet, ministers and officials of the government present here. Excellencies, members of the diplomatic and consular corps. The United Nations Resident Coordinator and the heads of other UN agencies, Superintendent Monserrado County, members of the press, distinguished ladies and gentlemen, good morning. Thank you, Mr. President, for being here despite your heavy schedule. We are very happy to receive you, sir. Today is an important day for Liberia, an important day for Liberia's health system. Liberia faced COVID-19 with resolve and courage and determination, despite the weak health system. The transition from Ebola virus disease outbreak in 2014-2016, indeed an epidemic of international concern, to a pandemic within a period of 4 years, is not an easy thing to comprehend. Though the health system had not recovered fully from the impact of this devastating Ebola disease, it has faced the pandemic on equal footing with other countries that have strong health systems or countries that have never tested an epidemic of disproportionate magnitude. We all know in such circumstances, as human beings, we are obliged to adapt to every situation despite our own strengths and weaknesses, because we must survive. This is our story, and this has been our journey in the fight against the COVID pandemic. Under your leadership, Mr. President, you invest the time and energy and instituted all necessary mechanisms to keep Liberia safe from the scourge of the pandemic and other diseases of epidemic potential. Today, Liberia is proudly looked at in a positive manner as a reference point on the success of COVID-19 response in Africa and beyond. Congratulations, Mr. President, because this is an indelible mark. The lessons learned here will go a long way and will contribute to shape the history of public health emergencies for generations. This success did not happen by chance. You did it. You gave the direction. You prioritized health and ensured all Liberians can emerge victorious from COVID-19 pandemic. Once again, congratulations, Mr. President. For almost 955 days since the first case of COVID was confirmed in this country, the incident management system that you entrusted to technically handle the response has maintained a faithful coordination platform for the national response. Permit me, Mr. President, to appreciate few personalities for this faithfulness. I start with the Honorable Minister of Health, Dr. Mlimina Jela, and the colleagues from the Ministry of Health, as well as the National Public Health Institute of Liberia. I appreciate Ambassador D. Maxwell Sir Kemia, Dean of Cabinet, and Minister of Foreign Affairs, ably represented by two lieutenants, Ambassador Lawrence Magi and the late Sheldon Jackson, may he so rest in peace, the former Assistant Minister for Cooperation. I recognize too Madam Mary Bro as the National Coordinator and her role, an exemplary role in leading the vibrant COVID vaccination center, which have never stopped since then. Our development partners, the US CDC, USAID, colleagues from the UN agencies. With their direction, Mr. President, the IMS has been instrumental for taming COVID-19 using the available strategies. I'm sure there will be opportunity for a national reflection on Liberia's success in fighting the pandemic despite our weaknesses. Mr. President, distinguished ladies and gentlemen, we gathered this morning to witness the commissioning of the first medical pressure swing adsorption oxygen plant. We abbreviate it as PSA oxygen plant. The PSA oxygen plant are a source of medical grade oxygen. The plants are designed to concentrate oxygen from ambient airspace with output capacity according to oxygen demand. These plants have been established, as mentioned by the superintendent, has capacity to produce to fill 100 cylinders per day, and each cylinder has approximately 6,800 to 7,000 liters of oxygen. So this supply should be adequate for the health facilities in Montserrat and the surrounding county. Oxygen is essentially required in all our levels of health care, in primary, secondary, and tertiary. And only high quality oxygen, medical grade, will be given to patients. Many countries, including Liberia, felt the demand for oxygen and intensive care units in 2020-21 during the waves and upsurges of the pandemic. Other medical conditions that require oxygen were barely prioritized because of scarcity. The limited availability of these resources result in an added risk of adverse outcomes. Also, we have witnessed the widespread unregulated use of oxygen by general public in household settings due to panic poses safety concerns. With installation of more oxygen plants in Monrovia and other parts of the country, never again will Liberia be challenged by lack of high-quality medical-grade oxygen. We are confident that all the health facilities, whether public, private, faith-based institutions, will benefit from these services. All will be included. This facility came as a package, Mr. President, and delivering this as a package. The facility itself has adequate space for the plant with inbuilt workstation and area for cylinders. It has office space, store for spare parts, and a training unit. We all know the spare parts are critical for the viability of any machine. It has a 1-year service contract to ensure preventive maintenance and also build skills of local biomedical engineers. There is a standby generator with the provision of fuel for 4 months. This helps in transition to a more sustainable way that the government will take over. Further, to improve the capacity of this plant, WHO has initiated and will donate 1 vehicle to facilitate coordination and the distribution of this oxygen. And also, because it is close to the infectious unit, WHO will be providing 2 well-equipped ambulances specifically for the use of the infectious center. I'm happy, Mr. President, that this plant is managed by Liberians who were trained over a period of 2 weeks. They picked up quickly and will continue to manage the plant. Mr. President, distinguished ladies and gentlemen, WHO is able to present this plant with support from international partners. The oxygen plant was procured by funds from the government of the Federal Republic of Ghana, while the rehabilitation work and equipping this facility was funded by the United States Agency for International Development and Department of Foreign Affairs and the Trade Canada. Thanks to the governments of these private countries for the general support. We are very grateful. The plant will save more lives, not only from COVID, other outbreaks may occur in the future, or other emergencies, medical emergencies may occur. But importantly, it will save the lives of our children who are dying from pneumonia countrywide. The plant was technically installed here by a team of experts from South Africa, and they were able to train 20 biomedical engineers to save the whole country. 4 will be based here at the starbase. And the same company will continue to provide periodic maintenance as stated in the agreement. Mr. President, I'm pleased to inform you that WA is installing the second plant in Tamanpa, Omi County, with the support entirely of the American government. The funds from the American government were used for preparing the plant and the construction of the facility. And this facility should be operational in the next 2 to 3 weeks' time. I extend the invitation to you, sir, to also praise the occasion. These plans are tangible assets to improve delivery of quality health services in the country. The impact of our work is measured by improvement in the quality of life and better health outcomes in the communities we serve. This is in fulfillment of the proposed agenda of prosperity and development to bring services to the community. As I conclude, Mr. President, the collaboration with your government, especially the Ministry of Health, has been instrumental in the rehabilitation of this facility. Special thanks to the Infrastructure Unit, Ministry of Health, for the rigorous oversight and the technical guidance. You cannot imagine that one engineer from the ministry was able to oversee this work. I extend thanks also to the Health Services Department, Ministry of Health, under whose purview the emergency medical services is located, including management of this oxygen in this location. I recognize the able support from our Superintendent, Honorable Florence Brandy, for dedicated engagement and collaboration to improve the health of this country. Let me further appreciate the company that WTO contracted to do this work for completing the work on time. Finally, the security of this place is a priority and urgent. Thanks, Mr. President, to the Chief of Staff of the Armed Forces of Liberia, Major General Prince Johnson, for extending support to this facility. Security of these assets is paramount. What we see today is a true demonstration, a collaborative work with the government and the partners, especially the international community, including the United Nations, to make services available to Liberia. Thank you very much for the attention.
All right, Dr. Clement Lugala Peter, World Health Organization Country Representative in Liberia.
Special remarks. We at this time call on the Ambassador of the Federal Republic of Germany for remarks.
All right, the German ambassador moves up front to make a remark.
Thank you, sir, for the promotion. I'm afraid I'm only the Deputy Ambassador and Charge d'Affaires. Good morning, everybody. Your Excellency, Dr. George Weah, President of the Republic of Liberia. Your Excellency, Claire Marie Weah, First Lady of the Republic of Liberia, Dean and members of the Cabinet, members of the UN family, ambassadors, members of the diplomatic corps, media representatives, distinguished guests. This is a good day for Liberia. It is a good day for the people of Liberia. As Ambassador Jacob Hazelhuber is out of the country, I am delighted that I might join the commissioning of this plant today. The ambassador had a chance to tour it last week, and he was most impressed with the state-of-the-art machinery which has been delivered and installed here, and which will definitely make a change to the health and well-being of the people of Liberia. together with a rigorous training of biomedical technicians and operators, as well as timely and careful servicing and maintenance of the installation, this oxygen plant can serve the people of Liberia for many years to come. I am happy that Germany undertook to co-finance this worthwhile project. In fact, since I took up office last year, this is the third time that I have the honor to participate in a handover ceremony in the medical sector. In September of 21, Germany donated more than 900,000 face masks through WHO to Liberia. And in June of this year, more than 580,000 doses of Pfizer-BioNTech COVID vaccines were supplied to Liberia. Of course, our friends from GIZ and KfW, as well as numerous German NGOs, some of which receive German government funding, are also active in the medical sector in Liberia. I am happy that Germany stands by the side of Liberia as a faithful partner and friend. I wish the people of Liberia a prosperous, a healthy future. With the commissioning of this plant, this goal has become more concrete and attainable. Thank you.
All right, a brief remark there by a representative from the
Thank you. At this time, we will now welcome
Liberia.
Ambassador Roy Donovo, Acting Mission Director, USAID, representing the Ambassador of the United States.
Your Excellency, President Weah and the First Lady, Dr. Wilhelmina Jala, Minister of Health, other government officials of the government of Liberia, Your Excellency, Deputy Ambassador of the Federal Republic of Germany, Neil Scott from the United Nations, and Dr. Peter Clement of the World Health Organization, other members of the Diplomatic Corps and development partners, distinguished ladies and gentlemen, on behalf of the government of the United States, I extend our sincere congratulations to you, Mr. President, and the government of Liberia for establishing this oxygen production facility. And I thank our partners in the German and Canadian governments whose funding made this possible, and the WHO for their hard work turning funding and vision into the reality we see before us today. And as we celebrate opening of this facility, we join Liberians in celebrating another major health achievement. Liberia is one of the first African countries to achieve the World Health Organization's goal of fully vaccinating 70% of its population against COVID-19. Liberia achieved this enviable vaccination rate because of strong partnership between Liberians and the international community. Liberians working at all levels of the national health system share the credit for this accomplishment. The national level leaders, many of whom are here with us today, the county level teams and officers in charge, the physicians, nurses, and physicians' assistants, and the community health workers who are present in all of Liberia's 15 counties. They were at the forefront of Liberia's fight against COVID-19. They were leading awareness campaigns and combating vaccine hesitancy. They were in communities getting shots into people's arms. And I had the great pleasure of meeting many of these dedicated men and women when I visited the Salala Clinic last week. The enthusiasm and selfless dedication they bring to the job of caring for the sick deserves special recognition. But COVID-19 is not over. In Liberia and around the world, we have, however, turned a new page in our response to the pandemic. We did so because of smart investments we made in tackling the disease. The oxygen production plant we are inaugurating today is an example of how those investments are building a more resilient Liberian healthcare system, improving basic care now while preparing for the future. We would like to see Liberia replicate its successful COVID-19 vaccination campaigns. Liberia must now make even greater gains in routine childhood vaccinations to protect Liberian children against deadly but preventable diseases. The fight against COVID-19 has taught us some useful lessons. It's taught us the importance of strong collaboration with our Liberian partners. It showed us the value of effective coordination between health authorities at the national and county levels. And we once again learned about the gains that come from using local voices as agents of behavioral change. We eagerly look forward to building on these lessons with all of you here today. They must inform our efforts to strengthen healthcare delivery all across Liberia, not just in Monrovia. And they must guide us as we work to build a surveillance system that timely detects and responds to future outbreaks. This new oxygen plant is an important step to ensure that Liberia has the resources to respond to health crises and provide quality health care for its people. Mr. President, on behalf of the United States, I offer our thanks and congratulations to everyone who made today's achievement possible. Thank you.
Thank you. At this time, we would now also call on Ambassador Neil Scott, UN Resident Representative to Liberia.
Indeed, Your Excellency, Dr. George Weah, President of the Republic of Liberia, Your Excellency, Weah, First Lady of the Republic of Liberia, government ministers, I salute the Minister of Health, members of the Judiciary and Legislature here present, Your Royal Highness, leaders of the Montserrado County, members of diplomatic corps, United Nations colleagues, and I salute particularly Dr. Clement, not a representative of the World Health Organization, members of the media, esteemed ladies and gentlemen. It's a privilege and honor to be here today to join you in commissioning this first medical oxygen plant in Liberia, a milestone for Liberia's health sector, destined to further strengthen the health system following the devastating COVID-19 pandemic. And let me congratulate you, Mr. President, and the government, and all the Liberians for the zeal and the resilience that you showed to combat COVID-19. Liberia has demonstrated strong determination to triumph over this unprecedented pandemic. And Mr. President, your leadership, your guidance, and the concerted efforts in ensuring all Liberians are protected against COVID-19 has singled out this country among the very few in Africa where the disease has decisively been controlled and its threat in communities is being lowered gradually. But COVID-19, as we know, is unpredictable and can frustrate us, and so it requires collective and sustained efforts to drastically minimize its effect on our health, on our economy, and on our survival. But as we stand here today, the progress we see gives us hope for the future and reaffirms the determination to treat this virus and other diseases of epidemic potential with the attention that they deserve. Mr. President, you champion with the Minister of Health a whole-of-government approach to deal with the COVID-19 pandemic by engaging and empowering communities to keep themselves safe. We will need the continued collaboration and resilience of the health system and communities, as well as the solidarity and the strong partnership with the international community to totally control COVID-19, but also to mitigate further public health threats. Each loss of life leaves a scar for families and communities, but also threatens to unwind decades of progress that has been made towards reducing infant, child, maternal death, and controlling HIV/AIDS, malaria, tuberculosis, non-communicable diseases, and other health priorities. Mr. President, distinguished ladies and gentlemen, in July last year, the world witnessed a serious upsurge of COVID-19 cases driven by new variants. The severity of the disease, coupled with consequences of prolonged hospitalization and increased death, pushed the health system here, as in virtually every other country, to its limits. Liberia was not spared, but like so many other countries, this upsurge left the health system struggling in dealing with the intensive care units and a lack of medical oxygen. Did we lose lives at the time which could have been saved? The struggle and the shortage of essential medical supplies and the need to keep patients alive due to the global demand, this was very much on our minds at that moment. But the lessons we've learned from this pandemic is that we need to move forward, and we need to lead or create a health system which is stronger than the health system we found at the beginning of the pandemic. And this oxygen plant here, located in Starbase, is one of the several valuable and tangible assets which exist, which will strengthen the health system and combat future epidemics, but also increase access to health services, and that will mean better health outcomes. This timely investment in a medical oxygen plant and further plants beyond will go so very far to contributing to the improvement of Liberia's healthcare system. Investing, as the pandemic has taught us, in a health system must be at the center of development. Health is a prerequisite, it's a gateway to security, peace, and prosperity. So let me thank you, Mr. President, your government, all those people who work so hard within your government and the teams that are constituted. Let me also thank the UN system, thank Germany, the United States of America, Canada, for this gift of this oxygen plant. And again, we see what is possible with cooperation. And it reflects the solidarity that we've all learned from dealing with this pandemic. The oxygen plant at the Starbase was installed with the help of the World Health Organization. Is one of 11 plants to be installed in selected counties around the country with the support of the international community, including the United Nations. These plants will bring health services closer to communities. And this is absolutely the aspiration of Sustainable Development Goals, in fighting disease and strengthening health systems and increasing access to health services, and ultimately in leaving no one behind. It's an aspiration of your government through the Pro-Poor Agenda for Prosperity and Development to bring services closer to communities. The communities in rural areas cannot be deprived of precious medical oxygen, as indeed of appropriate health care. Mr. President, distinguished ladies and gentlemen, on another successful front, let me join with the international community in congratulating you in the progress achieved in covering, in the vaccination coverage against COVID-19. The vaccines have shown that they can reduce severe forms of this pandemic. The figures are there, the evidence is there. Improving quality of life, but also leading to economic development. And we hope that this progress on a national level in vaccination will also serve to motivate performance in some of the less performing counties to achieve herd protection, which will be the basis for ultimately protection, full and final protection against COVID-19, so that the health system does not once again become overburdened. In conclusion, may I reaffirm to all of you the commitment of the United Nations in supporting the government and all Liberians to strengthen the health system and support the country's efforts in recovering from the COVID-19 pandemic. Thank you all very much indeed.
All right, Dr. Mills, start.
His Excellency Dr. George Weah,
Let's go back to the podium.
Her Excellency Madam Weah, the Diamond Cabinet, Ministers, Ambassadors, members of the UN Agency, Cabinet Minister, His Excellency King Yoruba King, members of the press, ladies and gentlemen. It gives me the distinguished honor to welcome for special remarks Honorable Dr. Weah S. Shatta, Minister of Health, Republic of Liberia.
All right, Dr. Jala will make a remark at this occasion. She walks
Good afternoon to all.
up front.
After that introduction, may you allow me to stand on the existing protocol instead of repeating what I. As we all say, water is life, but I would say oxygen is life. Because when you need that oxygen and it's not there, then you are not here, you are there. So in 2020, January, when the world was spreading about COVID-19, along with our partner, the MOH, decided to do an assessment of where we were in terms of oxygen capacity. And I'm sure you listened to the news where they said Liberia didn't even have a ventilator. And so it was a big deal in the social media, no ventilator, no this, no that. Anyway, the assessment helped us to be able to at least locate one ventilator that was all the way in Tapeta that we brought. And you should have seen that ventilator. It was like the old-fashioned type. We were trying to figure out how we were going to use it. But during this time, at least we were able to get some oxygen concentrators, we were able to get tubings, and we were able to do training of oxygen capacity within the country right before the first COVID-19 case hit Liberia. Once it hit, we did not face any difficulty. You saw the video where people were dancing in the recovery place, and we were not taking this whole thing, the public were not taking this whole thing very seriously. But we kept the IMS that the president elected, the sparkle, and all of the partners who still met every day to decide what was going to happen. Nobody knew the condition. However, in July of 2021, when we did not know that it was the Delta variant, but we knew that symptoms of low oxygen were raving in the country. Many of you experienced where office mates, friends, and relatives died because of low oxygen within their body. That was a sad time. I don't know about you, but that was a time when I sat in my room and I shed tears because we did not know exactly how to combat all of this rapid oxygen depletion that was happening. But through the Excellency, you were able to help us to locate oxygen. And through our very special partner, he was able to donate and bring in oxygen for us every day. Can you imagine? One person, 15 liters, 3 canisters, complaints, and other things. But the team that was here at the Starbase stood the test and were able to provide the necessary care that everyone needed. So if we were permitted, Mr. President, to ask our Starbase team, the team that were here at the infectious disease unit, taking care of the patient, to please stand so that we can see. our case management has stood the test. They too shed tears. Many of them when they watched their friend pass right before their eyes. But thank God we were able to cross that. You may have your say. At this movement that they said today COVID-19 cases are minimum, only Montserrat County, because this is the largest county. This is where everyone comes in and goes out. We still have a few cases in Montserrat County, but most of them are in home-based care, so they are not out in the public. Like they also was stated, our vaccine coverage is at 77%. The third highest in Africa, not even West Africa. Thanks to all those who donated vaccines to the Republic of Liberia, and thanks to all of the stations, including Madam Weah, who have one of the very unique vaccination sites that you can go and get drinks and food, and so people poured into one thing. Mr. President, because of your great leadership, we have made a lot of gains. We were able to set up at the airport one of the unique entry points that when you came into the country, you were able to pass through a very nice area to be checked for COVID-19 and for you to go to the different areas. We were able to set up, right now we have electronic vaccine cards. So most countries still dealing with paper, our is electronic. Our laboratories production has increased, and we're able to test each and every person that needed to be tested, whether you were going or coming. So thanks to our laboratory staff. Today also, before we knew what variant of the COVID-19 there was, we had to send it out. It took 2 weeks, sometimes a month. We even had to send a team to the United States to follow the test and samples to go and check on the sequencing. Today, we are able to sequence our own COVID-19 variant. Our cross-border, we are really working with our neighbors, because you cannot stop people from coming in and going out of the country. So our cross-border counties have centers that when you're coming in, you can go to Freetown, you will see one of them. If you enter it, we can check you, and if you're going out, we can also check you. So we have improved on all our cross-border surveillance, and we have already done our assessment to see how ready we are for any other pandemic that will come into the country. Thanks to Enfield and the team. Now, to oxygen plants today, we are very proud. To our partners, especially WHO, USAID, and all those who sit with us at the table. And we haven't stopped sitting here. We only reduced the number of days that we sit at the IMS. Before we sat every day, then we went to 4 days, then we went to 3 days. Now we still meet 2 days a week to discuss the safety of the people here in Liberia. Thank you. Now, oxygen training have gone across the counties, and we have 12 plants that will be located from Montserrat to Grand Cape Town, from Grand Cape Town to Grand Gide to Bon, Bapolu, and all of the different counties. Grand Crew also have a plan. What you will be saying or thinking right now is sustainability. How are they going to sustain all these things? But with our partners and with our own initiative, we want to make sure that we have a business model, because you need to continue to support the people that will be working in the plant. We have to make sure that we deliver all of these oxygen to all of the facilities. So you have to have a business model to maintain such an establishment. Now, we want to encourage all those health facilities that were not able to come. Please, oxygen, medical grade oxygen is available for all of you. This, we no longer want to hear that somebody with asthma or in the operating room or anywhere had any issue with that oxygen be the last thing that we are worried about moving forward. So with that, I will say thank you to all of our partners who have made this day a special day for the president and for the people of Liberia. We want to thank our team. We want to thank the foreign minister because he also goes out and initiates these things, and we just take it over and complete it. Thank you, Your Excellency, for giving us the opportunity to serve the Liberian people, to improve their health, and this is a continuation of all of our work, and we hope that the needed help that Liberia needs will continue to come in spite of all of the difficulties, all of the challenges all over the world today. We have to scratch our back before somebody can work on us. Thank you.
Dr. William Angela is the Minister of Health there with that remark. If you just join us, you're watching the EOS-based Focus on Liberia Online Television.
Her Excellency, Mrs. Weah, First Lady of the Republic of Liberia, members of the 54th Legislature,
at the podium now is
the Dean and members of the Cabinet, members of the Diplomatic Corps,
Chief of Protocol,
the One UN family, our
function,
development partners, the Superintendent and other officials of government here present, other guests, members of the press, distinguished ladies and gentlemen. It is my honor to invite for special remarks His Excellency Dr. George Weah, President of the Republic of Liberia.
All right, President Weah moves up front. Bounce the podium.
Thank you. Have your seat. Notice I have the same problem in Knee Scout. We are torn the microphone short. Madam Weah, Dean and members of the Cabinet, join the members of the Diplomatic Corps, all members of the Liberia government here present, representatives of our international development partner, members of the Political Legislation here present, members of the full estate, distinguished ladies and gentlemen. I'm delighted to be here today to witness the commissioning of the medical oxygen plant, the first of its kind in the country, with the capacity to produce as much as 100 cylinders of oxygen per day. I'm told that the establishment of this important plant is the result of the collaboration between the government of Liberia with the World Health Organization and with financial support from the government of the Federal Republic of Germany, the United States, and Canada. On behalf of the government and people of Liberia, I would like to express
Sincere thanks and appreciation to the government of these three countries for supporting Liberia in the fight against COVID-19 and strengthening our health system. I've been further informed that the United States government is also supporting the World Health Organization to establish another oxygen plant in Bowman County, and that this is nearly completed and will serve health facility in Bowman, Kidman County, and Bakuru County. We place immense value on this timely support to protect the country against future emerging and re-emerging public health threats. In addition to these two liquid oxygen plants, the Ministry of Health has prepared and presented a roll-out plan for the establishment of 11 more oxygen plants throughout Liberia. This represents a commitment of my administration to bring more health services to our communities as we attempt to increase access to universal health coverage and protect the population from public health threats under the global agenda for prosperity and development. These investments in oxygen plants will not only help in addressing any resurgence in the COVID-19 pandemic, but will importantly serve all hospitals with the treatment of other perennial diseases such as pneumonia that tend to persist long after the pandemic. Distinguished ladies and gentlemen, Liberia stands today with both pride and humility among the few countries globally that have successfully managed the COVID-19 pandemic, despite the challenges presented by our health system. The stabilization of the COVID-19 situation and the declining trajectory of new infections in the country is a result of my government's swift action in leading and managing the response in collaboration with our international partners. Today, I am pleased to announce that the Ministry of Health has confirmed to me that since the beginning of this year, no death related to COVID-19 was reported nationwide. However, COVID-19 remains unpredictable, as the ministry has recorded 317 cases in August and 70 cases in September. I am told that the number of new infections is unlikely to exceed 70 during this month of October. I thank all Liberians for cooperating with the government and for adhering to health protocols. We will continue to take all necessary steps to protect the lives of all Liberians. Our journey towards building health immunity against the pandemic is also in full swing. Liberia is winning the battle on this front, with the vaccination coverage reported as being about 76%, thereby putting us as a country in the third position on the African continent. Distinguished ladies and gentlemen, COVID-19 has not disappeared globally and will mutate to more dangerous variants. However, we remain committed as a government to continue our effort to reform, revitalize Liberia's public health systems, and will continue to take the essential steps to render them more robust and resilient. On behalf of the citizens of Liberia and our country, I would like to thank Dr. Clement, Ghana Peter, and our international partners, members of the Sparkle team and the Starbase team for the gift of life, which is the milestone. We are grateful to God for His provision. Thank you.
Thank you. We made some